electroconvulsive therapy. In this lecture, we will be discussing the indications to use ECT, pre-procedure care, during procedure and post-procedure care, and also the side effects of ECT. So ECT is when a small amount of electrical current is delivered through the electrodes which are attached to the temples, and it causes a brief seizure activity within the brain. Indications to use ECT. Prior to starting the ECT treatment, physician evaluates the risk versus benefits. ECT is given in depression when the antidepressant treatments were not effective. It is also used when a client had a good response to the ECT treatment in the past. It is used in extreme agitation or stupor, severe depression, and bipolar depressive disorders or schizophrenia. So these are all the indications to use ECT therapy. Pre-procedure nursing interventions is number one is the information. Nursing to ensure that the client and family has been provided information about the procedure and answer the questions, any questions they should have. Then consent. Ensure the informed consents has been completed. Then notify the client and family that the client requires to be fasting after midnight. Remove any kind of jewelry, hairpins, contact lenses, or dentures client have. Then change the patient into the hospital gown. Obtain the baseline vital signs. Insert an IV line in and ask the patient to void. Administer any pre-procedure medications and check the physician order for this. Attach the ECG electrodes. Ensure the oxygen, suction equipment, and resuscitation equipment is ready and functional. So these are all things we need to keep in mind pre-procedure. Care during the procedure. Continue to monitor vital signs throughout the procedure and administer oxygen. We can use nasal cannula or a face mask to deliver oxygen. Then place a blood pressure cuff on client's one ankle and inflate it. It will help to block the medication from entering that foot and will be helpful to monitor the seizure activity. Then client would be at risk of tongue bleeding. An airway or mouth guard can be used. And these are the instructions during the procedure. ECT aftercare. So, of course, we will continue to check the vital signs closely. And client may take 15 minutes to become awake after the procedure. So, client will require close supervision. Sometimes disorientation and the confusion may take several hours to resolve. So client will require frequent orientation and close supervision until the client regains the pre-procedure orientation back. So yeah. And then side effects of ECT. Side effects can be muscle aches, headache, confusion, as we just discussed about it, and it can cause tachycardia and a low blood pressure. So these are all the side effects of ECT. That's all about electroconvulsive therapy. I hope this will be helpful for you guys. Thank you.